Hi everyone, I am Dr. R. Soumya, Assistant Professor, Department of Electronics and Communication Engineering. Today we are going to see the topic IoT in Healthcare, the subject IoT based system design. IoT in healthcare refers to the network of connected devices that collect and exchange patient data to improve monitoring, care and operational efficiency. The key applications include remote patient monitoring through wearables, smart beds that adjust for comfort and safety, and connected devices like smart that track usage and provide alerts. The technology offers benefits like improved patient outcomes, reduced hospital stays, increased patient engagement, and greater operational efficiency for healthcare providers. Remote patient monitoring. Remote patient monitoring is the most common applications of IoT devices for healthcare. IoT devices can automatically collect health metrics like heartbeat, blood pressure, temperature, and more from patients who are not physically present in the healthcare facility, eliminating the need for patient to travel to the providers or patients to collect it themselves. Glucose monitoring. For the more than 30 million Americans with diabetes, glucose monitoring has traditionally been difficult. Not only is it inconvenient to have to check glucose levels and manually record the result, but doing so report a patient glucose levels only at the exact time the test is provided. If levels is widely periodic testing may not be sufficient to detect a problem. Challenges including designing an IoT device for glucose monitoring that is small enough to monitor continuously without causing a disruption to patients, does not consume so much electricity that it needs to be recharged frequently. Heart rate monitoring. Like glucose, monitoring heart rate can be challenging even for patients who are present in healthcare facilities. Periodic heart rate checks do not guard against the rapid fluctuation in heart rate, and conventional devices for continuous cardiac monitoring used in the hospital require the patients to be attached to wired machines constantly. Next one is the hand hygienic monitoring. Traditionally, there has not been a good way to ensure that providers and patients inside the healthcare facility wash their hands properly in order to minimize the risk and spreading contagion. Today, many hospitals and other healthcare operations uses IoT devices to remind people to sanitize their hands when they enter hospital rooms. This device can even give the instructions on how best to sanitize to mitigate a particular risk for a particular patient. A major shortcoming is that this device can only remind people to clean their hands. They cannot do it for them. Still, research suggests that these devices can reduce infection rates by more than 60% in hospitals. Depression and mood monitoring. Information about the depression symptoms and patient's general mood is another type of the data that has traditionally been difficult to collect continuously. Healthcare providers might periodically ask patients how they are feeling, but were unable to anticipate sudden mood swing, and often patients do not accurately report their feelings. Thank you.